Guild. I'm with Hotel Talk, and today I'd like to welcome back Greg Hammer, Dr. Greg Hammer. The first interview we did, we kind of introduced him and his new book that has come out, Pain Without Pain, the Happiness Handbook for the healthcare professionals. And today, I want to welcome you, Dr. Hammer, Greg, and we're going to talk about the chapter on burnout. And I think today that's a very pertinent topic. So I'm going to hand this over to you and let you share what you'd like to talk about.
Thank you, Eileen. It's great to be with you again. I think that the last time we spoke, we did speak a little bit about burnout and its drivers and the consequences and what some of the potential cures are. And certainly burnout is not something unique to the medical profession or nursing profession, the healthcare profession in general. Burnout is something that people in all walks of life experience, including parents, for example, children even may experience burnout. If we define burnout as emotional and physical fatigue that results from stress, and the stress can be internal, that is the way we perceive the world and think of the world, our thought processes, and the stress can be external as well. And of course, there's no barrier necessarily between what's internal and what's external. It's a continuum. So it's basically a stress-related phenomenon by virtue of which people feel fatigued and they lose their patience. They tend to have a cynical outlook. They depersonalize others. And in other words, if they see somebody who has some misfortune, they tend to consider that that person brought it upon themselves, kind of explain it away. So this is something that we see in all walks of life, and especially now during the COVID pandemic. I think that burnout is quite common by whatever name we might assign to it.
I can't agree. Yeah, so I can't agree with you more. And I think burnout has become such a common factor in everyday life. And with the fact that this COVID epidemic that we have doesn't seem to be slowing down any, talking about burnout is very important. So in your book, you go into some details about some examples of burnout with the medical profession. And do you want to share with us some real life stories of people who have actually experienced burnout?
Sure. I give an example in the book, which is kind of a generic example, but it's about John, who's an internist. He's an internal medicine physician, and he's sort of in the middle of his career, maybe in his 40s or early 50s, and he's been working in a clinic, and over time he's experienced the change in the culture of the clinic and the efficiency of the clinic, and those are not changes for the better. For example, the culture is such that there's a performance pressure that he's expected to see more and more patients per hour, but he and others have not been given the infrastructure in which to do that. So in other words, the administration says, well, we want you to see more and more patients per hour, but they're not providing more clinic space, more exam rooms. They're not providing more assistance in terms of technicians and nurses who help staff the clinic. And so his practice is full of pressure. He's exposed to a lot of metrics related to patient satisfaction, for example. Of course, his patients are dissatisfied because the waiting period in the waiting room is becoming longer and longer. As you can imagine, if he's being asked to see more patients every hour, the clinic scheduling process is not well set up to handle that. And again, because he doesn't have the infrastructure to process more patients every hour, the waiting room, the exam rooms, et cetera, the patients are unhappy, and so his Press Ganey or his patient satisfaction scores are down, and yet this is not because of the care that he provides or his interactions with the patients. It's just that the patients are unhappy about waiting longer periods of time and having less and less time with their physician when they do get to see their physician. So these are sort of cultural elements and also go to the efficiency of practice. His practice is becoming more and more inefficient as the waiting times are going up. And generally there's just a little bit more chaos in the clinic. And, you know, this is just a result of overcrowding, the scheduling.
So, yeah, I can imagine it's even worse now with what's going on and the fact that people can't, like, some people can't even go into an office now and everything's done virtually. I know I recently had to have a doctor's appointment. They canceled my ability to go in person, and we had to do it virtually. And I'm sure for some people that doesn't make them very happy. So when they are asked to review, then they may give a bad review. Fortunately, I'm okay with that because, you know, I wasn't having an emergency or anything. It was just a regular checkup. But, you know, how can people adapt, or, you know, do you have any suggestions for the consumer to be able to look at things maybe a little differently and not blame the doctor, or not look at their situation as something that is wrong with the way that the doctor is handling them?
That's a difficult one. You know, it just occurred to me that it's analogous to the situation with respect to our airline reservations, for example. You know, all the things that happen with our flights getting bumped back or canceled at the last minute, sometimes after we've gone to the airport. So who do we complain to? We complain to the gate agents if we're at the airport, because that's the only person we have with whom to interface, or it might be the agent on the telephone. And of course, it's not their doing, but we express our dissatisfaction to them when we're stressed. And so I think that this happens with patients and their nurse practitioner or physician. Or it just may be that they're expressing their frustration with the system when they fill out their patient satisfaction surveys, but that sort of gets washed out, and all the administrators pay attention to is the score and the bottom line. And you know, this is hurtful to us because we want to do our best and we want our patients to be not only healthy but happy, and we want them to be happy with our care. So, you know, back to John. John is in this set of circumstances where his work is becoming more frustrating, less autonomy. There are also these inefficiencies that are a result of overcrowding, and newer technology like the electronic medical record are actually lengthening his day. And so he's finding that he leaves the clinic at a later and later hour, and on more occasions has to bring work home, and this is at the expense of his time with his family, of course, and his personal time. Maybe he just kind of wolfs a very quick dinner, doesn't get to exercise, has to go back to his charts, misses out on the opportunity to interact with his kids while they're still awake. So this is a very common scenario for a physician, and it's not unique to healthcare providers, but this is how things have changed. And I think in our society in general, we find ourselves subjected to more and more pressure to perform. Margins are tighter and tighter, competition is greater, and so there's a lot of stress, and stress leads to burnout. And
well, I think it would also lead to a lesser quality of life. So, you know, it causes everybody to feel like all they do is work and don't have any time for downtime or family time.
Absolutely. And, you know, we may have discussed briefly the effects of stress and what stress may be adaptive versus maladaptive. And there's acute stress, and then there's stress that goes on for more than a short while, for days, weeks, months, and that's chronic stress. Acute stress may be adaptive. So for example, if you're being chased by a bear, you want your adrenaline level to go up. You want your cortisol level to go up. You want your blood sugar to go up. You want your heart rate to go up. You want more blood going to your muscles so you can run, and you need the sugar in order to convert that to energy. Or it may be, there's a child that fell into a swimming pool and suddenly get alarmed and stressed, and your performance in terms of jumping in the pool and getting the child out may be augmented. So that kind of stress may be adaptive. And it's important to recognize that the acute stress is not necessarily bad for us. It's really our ability to bring our adrenaline and cortisol levels back down to baseline as quickly as we can. And that's what resilience is. But when that stress and those hormonal and other changes persist for more than a short period of time and it becomes chronic, it's clearly maladaptive, because the increase in adrenaline taxes our heart and blood vessels. The increase in cortisol causes our blood sugar to be elevated. We may develop type 2 diabetes. Our sleep is compromised. We become fatigued. And when we're fatigued, we tend not to eat as well because we reach for unhealthy foods to try to give us a bit of a boost. And so this is all sort of a positive feedback loop. We're stressed, so we have a strain on our physiology, on our cardiovascular system, for example, on our hormonal system, on our blood sugar. We sleep less well, we eat less well, and those things make us more fatigued. And so on and on it goes. And this sort of chronic stress is clearly maladaptive and imposes changes on our body that are akin to aging. So for example, we can look under the microscope, if you will, at the protective ends of our chromosomes, which have a structure called telomeres. And telomeres are kind of akin to those little plastic structures at the end of your shoelaces that keep your shoelaces from fraying, and they protect your shoelaces. And when those telomeres become frayed and shortened, which happens when we age, our chromosomes are more prone to damage, and this accelerates the aging process. So it's both a sign and a cause of aging. And when we have chronic stress, our telomeres become shorter. So I think we can accurately and objectively say that chronic stress causes us to age in a more accelerated fashion. So clearly, this kind of chronic stress is deleterious and maladaptive, and we should pay a lot of attention to how we can reduce it and be resilient.
So what kind of suggestions or are there options for people in the medical community to have some resources to help them to manage the stressors that can lead to the burnout that you talk about?
That's a good question. And we at the Stanford WellMD program have developed a rubric. I didn't develop it, but I'm the beneficiary of those wise sages in the WellMD program who did. And one can imagine a circular pie divided into 3 slices, and each section represents a particular type of or class of drivers for burnout, and also points to the cures for burnout. So the first one is the culture of medicine. And if you look at the society at large, it would be the culture of our society. But in medicine, culture of wellness has not been ideal, to say the least. And we're very much programmed to take good care of our patients. And this can be at the expense of our self-care. And I think the culture needs to move more toward self-care first, because if we don't take care of ourselves, we're less well equipped to take care of our patients. There are data that when physicians are burned out because of less than ideal culture in medicine, in other words, burn it at both ends and always take good care of the patients, and even if it's at the expense of taking a lunch break and exercising, having good nutrition, focusing on our own sleep, that more medical errors are made. So errors in medication, surgical errors, the nature of our medical care suffers, and in fact, mortality rates go up in hospitals when the rates of physician burnout and healthcare provider burnout increase.
I would think some of that is due to fatigue, mental fatigue, physical fatigue, because of, lack of nutrition, the right nutrition that they need, lack of sleep. And I'm sure medical errors is a challenge, and it can be prevented.
Absolutely. No, something like 400,000 serious medical errors happen in the United States every year. And this results in about 100,000 excess deaths. And it's interesting when you look at the rate of medical errors and mortality related to mistakes in medicine, it's about the same in all first world countries around the world. So there's a certain baseline of human error is what it is. And I think this occurs in other industries as well. But certainly, those rates of medical mistakes, if you will, and mortality go up when burnout rates go up. So this is part of the culture of medicine that we need to change. We need to focus more on self-care and not gloss over the needs for ourselves to take breaks, to eat well, to exercise, to have good sleep hygiene. So that's largely a question of leadership and, it's certainly a financial overlay because, sometimes making these changes may cost money, but it's sort of the missing piece of looking at the value in our healthcare. And that missing piece has been, the personal health of physicians and nurses and respiratory therapists and other healthcare providers.
So is there a way for people is there actually a program that is available for medical professionals to either look up or to a number they can call if they need, if they feel like they, want to have some help or some guidance?
Well, there's suicide hotlines, but I think this is largely a problem that needs to be dealt with by the leadership in our individual institutions. So our division chiefs, our department chairs, our chief medical officers and CEOs of hospitals and clinics, there needs to be more emphasis on taking care of the physicians and nursing staff and other healthcare providers. And this is really a matter of leadership. There may be a financial cost for that, excuse me. But if you look at the benefits of focusing on improving the culture of medicine, I think it's a cost saver. So, the culture needs to change, and I think it's a matter primarily of leadership. And I do believe the leadership are beginning now to recognize that burnout is a very serious problem, and it has serious consequences that are related to the quality of medical care, and there's a financial cost actually to burnout.
I can see that. Do you think meditation or some sort of practice that people can look into in the medical field would be beneficial for them?
Absolutely. So I think, again, going back to this pie with 3 sections representing the drivers and potential solutions to burnout, we talked about the culture. The second piece before I get to meditation is the efficiency of our practice. So this goes to, there's overlap, but this goes to also, if you're asking a physician to see more patients, you need to provide the infrastructure. We have increasingly the use of electronic medical records, and like many other advances in technology, it's a double-edged sword. So whereas we used to write all of our notes by hand and orders and prescriptions and so on, now this is being done with electronic software platforms. And, these softwares have glitches, as many of us have experienced using, Microsoft products or what have you, when you get to a glitch, it may crash your computer. The system may just kind of grind to a halt. But also, there's just a lot more clicks that are necessary to write our notes and write orders and so on. It seems like every week there's more clicks that are required as we pass through these drop-down menus and so on. And a lot of the information that we have to wade through seems kind of pointless. So, in other words, do we have to really record if a patient has a head injury, whether it's on the left side or the right side of their head, or whether it's, there's a skull fracture associated with it, or, those are not perhaps the best examples, but there's a lot of data that we have to enter that seems kind of pointless.
So I would think that would take away from the quality time that the doctor has with the patient, and that's partly the cause of some of the stress and the burnout.
Absolutely. I mean, it keeps us in the hospital or in the clinic longer, in the office longer, and it results in often taking work home, and we have the software on our computers and we can write our charts at home and so on. But, this is at a significant expense. So I think our practice in some ways has become less efficient. And, the proliferation of insurance companies and having to hire more administrative staff just to deal with insurance and so on. I never thought I would say this, but I'm actually in favor of a single payer solution at this point because of all of this inefficiency and how much of a time sink it is for ourselves and other people in the office. So the third section that represents drivers and solutions to burnout has to do with personal resilience. And this is the area in which I'm most interested. And the reason that I wrote this book, which is Gain Without Pain, because I think that gratitude, acceptance, intention, and non-judgment are really the pillars of resilience and happiness. Certainly not just for those in healthcare, but for everyone. And so I have a sort of a primer version of this book, which is called Gain Without Pain, Your Happiness Handbook. And then, of course, you and I are talking about doing a book together, which I think would be delightful. Gain Without Pain, the Happiness Handbook for entrepreneurs or, for
small
those
business, yes.
Yes. So, these principles, I think, apply to everybody, and the GAIN principles. And so this method, I think, can be very useful as an exercise in mindfulness, if you will. And, I think, again, that these four parts of the acronym GAIN are the pillars of resilience and happiness, and we can go through them. But I think gratitude is key and sort of central to most beliefs, systems, and philosophies and religions in terms of finding happiness and enlightenment. Acceptance is also expressed in most philosophies. The Serenity Prayer, for example, focuses on discerning between what we can change and what we cannot change, and having the wisdom to accept what we cannot change. And so this is, again, part of the GAIN methodology and part of the GAIN meditative practice. The I stands for intention, and that means, as John Kabat-Zinn defined mindfulness, as being in the present moment on purpose, non-judgmentally. So we can use our purposefulness, our intention, to help rewire our brains to shift this negativity bias that we have and begin to move away from this obsession we have with the past and the future and be in the present moment, which is really the only moment we truly experience. And it's the only time when we're really happy. Although, we can contemplate fond memories in the past, and we can look forward to happy events, I should say, in our future. But the times when we're really most blissful and peaceful really have to do with being completely present. If we think about it, it's whether it's an intimate moment with a partner, whether it's totally connecting with nature out on a hike, whether it is listening to a timeless piece of classical music, just being carried away and letting go of all thoughts of the past and the future. These are moments when we're in the present moment and when we're truly happy, and this feeling of separation that we have of being a separate self kind of dissolves, because if you don't have the past and the future in consideration, there is no separation. In this present moment, we are really truly connected and one, and that's where we find happiness. So that's something that we can use our intention to focus on. And, of course, I have a fair amount of the book devoted to that. And then the N is for non-judgment. We're constantly making judgments of things being good or bad, or too large, too small, making comparisons between other people and ourselves. I'm smarter than that person's better looking than I am. And these constant judgments, these comparisons are the wheels in our minds are just constantly turning, and it's actually subconsciously fatiguing us, and also leads to unhappiness. Whether we think something is good or bad, the things we think are good could change and be bad. So we're much better off adopting sort of a benevolent indifference to the world and just accepting the world and seeing the world exactly as it is. We didn't cause it to be that way, and we're not going to change it. Let's just embrace it exactly as it is. And I think, again, that's another pillar of happiness.
Wow, what wonderful words of wisdom from Dr. Greg Hammer. I think that's great. And I think it's easier said than done for a lot of people, because they have what I call the monkey mind, and the mind has they have a challenging time quieting the mind to be in that place of presence. And I think the ability to move from one moment to the next without dragging the past and worrying about the future is key to happiness and to avoiding burnout and stress. And I think your book is really important, is an important read for people to consider these four elements as one, as a grouping of what someone can do to implement strategies in their life to find that place of peace and groundedness. So I'm glad that you wrote this book, and I hope a lot of people find their way to it. And so
I think, Eileen, I'm sorry to interrupt. I think one of the important elements is to take small steps, but do so on a daily basis. So I think this is the basis for a good practice, whether you want to consider it a meditation, a contemplation, a way of living. Don't expect that you're going to just go from A to Z in one deft move. And I think, for example, with regard to meditation, a lot of people have had the sense, for whatever reason, that they're supposed to be able to sit still for 30 minutes without scratching an itch or repositioning their bodies, and they're not supposed to have any thoughts in their head other than their mantra or their breath or what have you. And that's just not realistic. And so my trainees to whom I was teaching this gain meditation would often say they just love doing yoga, they love doing this and that, it brings them into the present, but they don't have time, and they don't have time to meditate. So I kind of developed just a 3-minute practice and said to my trainees, tomorrow, instead of getting up at 5:45 or 6 o'clock, set your alarm for 5:42 or 5:57. So this gets your intention initiated the evening before, and it's 3 minutes. So I don't think any of us would say that we're going to notice 3 minutes less sleep. So you get up in the morning and open the blinds and do your morning hygiene thing, and then find a comfortable place to sit for just 3 minutes. And we start with the breath. a slow inhalation to a count of 3 and a pause for a count of 2 and a slow, effortless exhalation to a count of 4. And we kind of get into this rhythm. And when we slow our breath down, we actually activate our parasympathetic nervous system. That's kind of the part of the nervous system that balances the adrenaline-based part of the nervous system, the stress response. So it actually, by slowing our breath, it actually slows our heart rate and lowers our blood pressure, lowers our blood sugar. And then we just go through, it could be 30 seconds each of contemplating our gratitude, and we all have much for which to be grateful. Transitioning to accepting things. So it can be recognizing that there's a lot of pain and suffering in the world and that we as individuals experience pain and suffering, and picking something that's bothering us and really imagining opening our chest and opening our heart to this bothersome element and bringing it closer and closer and closer and merging with it. And while this might be slightly uncomfortable at first, we'll actually usually notice that there's not really that much there, not as much as we thought. Then transitioning to our intention, we can, set our intention for the day. Like, today I'm going to be kind. Today I'm going to be generous. Today I'm going to be non-judgmental of the first person I see who, as I'm driving to work, cuts me off or changes lanes without using their turn signal. I'm going to start to get annoyed and make a judgment, and then I'm going to realize, no, this was my intention for today, was not judging the first person that I see when I'm driving to work. And then going to non-judgment and just remembering to see the world exactly as it is. And again, we didn't make it that way. We're not going to change it much. Just accept it with open arms and embrace. And then go back to the breath. And this is as little as a 3-minute practice. And again, it's like baby steps, but do it every morning. And then we start to get into the practice of bringing elements of gain into our daily life. We're walking down the hall. We can be grateful. We can drop judgments. We can think of our intention. We can be accepting of something that was annoying us. So start small, but have a daily practice. And I think, we get a lot of important positive feedback this way. We feel a little better. We feel a little better dropping the judgment of that person who cut us off. And so we start to get little hits of dopamine, little pleasure hits of dopamine and serotonin as neurotransmitters, as chemicals in our brain, when we practice gratitude, acceptance, intention, and non-judgment. So I think I just wanted to really emphasize the fact that people should recognize this is very, very easy, user-friendly, and non-time consuming practice.
I like that. So I'm going to recommend that people, when they watch this, to rewind it or take it back and listen to what he said. Because I will say, as you were describing that the first step of the breath work, it actually, I could feel myself calming down. And I do practice that myself, but just hearing somebody else saying it and my being present with you while you're saying it, it did calm me down. Have you ever thought about doing an audio, or have you done an audio of yourself talking through this process for people to be able to download and listen to?
It's on my list.
It's on your list. So
it's on my list as a link on my website, greghammermd.com. Yes, I would love to. I've been meaning to do that.
I think it's a good idea because you do have a calming voice, and I can tell you're very compassionate and passionate about that. And I think it would be a great addition and something for people to be able to have as a extension of your book and as part of what you offer in your book. So
thank you for that, Eileen.
You're welcome. You're welcome. And thank you for bringing that into this interview. I believe wholeheartedly in meditation and the breath work, and it is calming. And I agree also with not judging. And, if someone's cutting you off, it's okay, because you don't know, they could be rushing to the hospital. They could be, something could be going on in their life. They're not doing it intentionally to you. Well, they may not be doing it intentionally to you. Right.
And so, even if they are, we don't have to judge them for it, right?
Right.
But there's so many examples where we judge people and then we find out later that those judgments were based on ridiculously untrue presumptions about somebody.
Right, and what we judged them on had merit. You know, what they were doing had they had a reason, a rightful reason. And
Yes.
yeah, so I think that's very important, especially if someone, even if you're not in the medical field, if you're feeling burned out, it might be a good thing to start implementing some of these GAIN principles. And again, his book is Gain Without Pain, the Happiness Handbook. And so tell people how they can find you and find the book.
Sure. Thank you, Eileen. I have a website, which is greghammermd.com. That's lowercase, no punctuation, GREGHAMMERMD.com. And there's a link to the Amazon site where the book can be purchased. There's a lot of other interesting information there, a lot of links to media, such as I think our first interview may be on there now, dozens of other interviews and other material I think people might find interesting. And for sure, I'm going to take you up on that suggestion of having maybe a few meditations linked there so that people can enjoy the audio and hopefully I can help them do a brief GAIN meditation.
I think that would be awesome. And please let me be the first one to know so I can put it out there for people. And thank you very much. I've enjoyed this interview and thank you for coming back. And we will be doing this again.
Well, it's totally my pleasure, Eileen. Anytime. I've really, really enjoyed it. It'll be one of the 3 good things in my day that I'll think about before I go to sleep.
Oh, that's nice. Thank you.
Yeah, I think we will talk about that when we get to intention, the 3 good things model. But yes, I've really enjoyed it and I look forward to seeing you again soon.
Okay, same here. Thank you.